Hello, everybody. My name is Zoom Heaton, and I am a pharmacist, and I'm also the Women's Health Clinical Liaison with Revelation Pharma. Today, we're going to be talking about a subject that is very near and dear to my heart. It is on women's hormones. And hopefully today I will be able to answer some of your burning questions and maybe put to rest some of the confusion that you may have had in the past. So today it is going to be about the overview of women's hormones. So what are we going to talk about today? We're going to start out with talking about what hormones are, what they do. I'm going to go through the hormone cascade, some of that, brief overview of that, and also we're going to look at the three major sex hormones, estrogen, progesterone, and testosterone. We're also going to look at some of the imbalances when hormones are deficient or they're in excess, estrogen progesterone ratio, and what estrogen dominance is and how it affects us. Hormonal stages, your pre, peri, and of course, menopause. And last but not least, the synthetic versus your natural hormone replacement and bioidentical hormones. So this is one of my favorite sayings. And every time I think about hormones, this is what I think about. For us to have a happy, normal, functioning life, we have to have balance. So good health is all about striving for the right balance. So we all need to find it. So we're going to start with, what are hormones? They are chemical messengers that are produced in the body. They control and regulate the activity of certain cells and organs. So essentially, your hormones tell your cells what to do. They are key components of overall health, and all your hormones in your body interact with each other, and they form a very tight, interconnected web, and they have to be balanced for optimal health. So to demonstrate how hormones work, we've got a steroid hormone here, and it has to find its receptor. And the receptor is like a home. So it has to find its home to be able to turn the switch on so that the cell knows what to do. And there's your cellular response once this binding occurs between the steroid hormone and its receptor. Endocrine glands secrete hormones directly into the bloodstream. And some major endocrine glands are the pituitary, the pineal, thymus, the thyroid, adrenal, parathyroid glands, the pancreas, ovaries, and testes. And of course, women make hormones in the ovaries and the adrenal glands. So don't panic. This is a steroid hormone cascade, and basically this is just a diagram showing how your hormones are made and how they're broken down. But the interesting thing I want you to see is that at the very top of this chart is cholesterol. Cholesterol is so demonized in this world for some reason, but yet it is the raw material that makes all of your sex hormones. It starts with pregnenolone. Without cholesterol, you cannot make pregnenolone. And from pregnenolone, it splits and makes progesterone and DHEA. It also makes your testosterone and your estrogens. So we've got to have cholesterol to be able to function. So here are the female hormones and the organs that produce them. So we start out with estradiol. Of course, it's made in the ovaries and of course indirectly through excess fat on our bodies. Progesterone and testosterone are also made in the ovaries, and small amounts are made from the adrenals. Now, a DHEA is also made, and it is one of the hormones that are pretty important. It's dehydroepiandrosterone. Say that 3 times fast. It's also made in the ovaries, the adrenals, and brain. We won't be talking about DHEA this time. We're going to focus on the top 3 sex hormones. But look for that webinar down the road on DHEA because it is a very important hormone that will help support your stress. Okay, so let's start with estrogen. It is a hormone that is produced in the ovaries. It is essential to a woman's sexual development. And the estrogen receptor sites are found basically everywhere in the body. And it is responsible for 400 different functions in the female body. Yes, 400 functions. So I don't know why estrogen is so bad. For whatever reason, everybody is scared of estrogen and they think that estrogen is evil. But yet, without it, we cannot function. Women who smoke have lower levels, and if you have a lower fat diet, you won't have as much free estrogen to work with. And estrogen is stored in fat cells. There are 3 main forms of natural estrogen. E1 is estrone. Estrone is the dominant form of estrogen during menopause. It is derived from estradiol. And the problem with estrone is that it does tend to stimulate the breast and uterine tissues at high levels, which increases the risk of breast and uterine cancer. So it is not normally supplemented in menopause. Estradiol, or E2, it is a strong form of estrogen. It's 12 times stronger than estrone and 80 times stronger than estriol. And it is the main estrogen that is produced before menopause. And most of the body's E2 is produced in the ovaries. And high levels, unbalanced levels, is associated with breast and uterine cancer. And then we have E3, which is estriol. It is a weaker estrogen, but it is the most protective against breast and uterine cancers. There are a lot of clinical benefits with estrogen. It helps make the good neurotransmitters in the brain, like serotonin. So it decreases depression, irritability, anxiety. Overall, it improves mood. It improves insulin sensitivity, increases concentration, increases sexual interest. It helps to regulate blood pressure, increases blood flow. It has a better overall cardiovascular profile. It decreases your lipoprotein A, which is a risk factor for heart disease, decreases LDL and prevents its oxidation, decreases accumulation of plaque on your arteries, increases your HDL by 10 to 15%. And overall, it reduces the risk of heart disease by 40 to 50%. That is huge. So some other clinical benefits of estrogen, just to highlight, it does help with energy, maintains memory. It also helps bone density. So you've got to have strong bones moving forward as we age. It also protects your eyes. It protects against macular degeneration, reduces the risk of cataracts. It reduces homocysteine, and that is an amino acid that is a risk factor for heart disease and Alzheimer's disease. Decreases wrinkles, increases collagen, decreases your risk of developing colon cancer, helps to prevent muscle damage. So much more. Remember, 400 different functions. Estrogen can be out of balance, and some of these are symptoms of deficiency. As you can see, a lot of these symptoms are why women come into the clinic and ask for help. Hot flashes, night sweats, anxiety, chronic fatigue, depression, diabetes, insulin resistance, acne, dry eyes, fibromyalgia, increased facial hair, restless sleep, osteoporosis, osteopenia, thinning hair, urinary stress incontinence and leakage, urinary tract infections, vaginal dryness, joint pain, food cravings, decreased memory or focus, brittle hair and nails, difficulty losing weight, vulvodynia, weight gain around the middle. There are also symptoms of estrogen excess. And a lot of these symptoms are very interchangeable with deficiency, like the hot flashes and the night sweats. But then you have bloating, and you have an increased risk for breast cancer. Your libido goes down. You have fibrocystic breasts, depression with anxiety or agitation. You can have headaches and mood swings, swollen breasts, poor sleep, heavy periods, hypothyroidism, water retention, uterine fibroids, weight gain, especially around the hips, the abdomen, the thighs, and an increased risk of uterine cancer, as well as an increased risk of developing autoimmune diseases. Now on to progesterone. It's a sex hormone. It plays a role in menstruation, pregnancy, and the formation of embryos. It is made in the ovaries up until menopause, and then after that, the adrenals take over. It is made from pregnenolone, which is the mother of all hormones, acts as a prebiotic in the gut, and of course, it balances estrogen. So here's your yang to the yin, which is your estrogen. And there's got to be balance. This is how you feel on progesterone. Some of the clinical benefits of natural progesterone: it balances estrogen levels. It's the yang to the yin. It has a natural calming effect. It helps with sleep. It's anti-inflammatory. It helps your thyroid hormones work better. It helps you to use and get rid of your fats more effectively. Increases hair, scalp hair. It lowers cholesterol and high blood pressure. It does stimulate the production of new bone, so you are building bone. It also prevents migraine headaches that are related to the menstrual cycle. Also improves libido, and it promotes myelination, so it helps nerves from injury. Some other clinical benefits of natural progesterone: it is a natural antidepressant. It decreases the rate of cancer on all progesterone receptors. It protects against breast cancer by inhibiting breast tissue overgrowth. It relaxes smooth muscle, increases your metabolic rate, increases the beneficial effects of estrogen on blood vessel dilation, so you don't have stiff arteries. So progesterone can get out of balance, and some of the symptoms of deficiency are listed there. Some of the main ones are like the mood swings and depression. You can't sleep as well. Sometimes you have trouble falling and staying asleep. Migraine headaches, irritability, anxiety, weight gain, decreased libido, just changes in your menstrual cycle, heavier bleeding, longer days, nervousness, osteoporosis, pain, inflammation, and some other symptoms of excess where you're bloated, you're gaining weight. A lot of times your appetite will increase if progesterone is out of balance and there's too much. It increases carb cravings, increases insulin resistance. It suppresses your immune system, and you can get gallstones, and of course it will also increase your cortisol, which is your stress hormone. So in this diagram, we're looking at estrogen and progesterone balance. There is a ratio between them that has to be maintained. And if you'll notice that from age 35 to 50, there is a huge reduction in progesterone, 75%. And estrogen is reduced by 35%. And if you'll notice at age 50, which is generally the perimenopausal phase where you're transitioning into menopause, that ratio widens because there's a bigger dip in the happy, healthy hormone progesterone. So these two hormones have to remain in a specific ratio in the body for balance to occur. And for example, they work together. to balance your body's release of insulin. So estrogen increases insulin sensitivity, while progesterone decreases it or creates more insulin resistance. So they need to balance each other out and work in concert, or else you could be thrown into a glucose intolerant situation leading to diabetes. An estrogen progesterone ratio that's too high, where too high in progesterone, you'll start to break down protein and muscle tissue. So this could make conditions like fibromyalgia worse, and your pain increases. Low progesterone to estrogen ratio can cause infertility. So you've got lower progesterone, higher estrogen, you've got abnormal bleeding, and here you've got an increased risk of breast and uterine cancer. And if you've got prolonged progesterone use, but you don't have adequate amounts of estrogen on board, you will also have a major imbalance, and weight gain comes on. You don't have as much of a sex drive. You have increased total cholesterol, triglycerides, and LDL, and then you have decreases in HDL, as well as depression and increased insulin resistance. So estrogen dominance is a condition that is rampant in this day and age. And Dr. John Lee, who was a pioneer in bioidentical hormones, described estrogen dominance in his first book on natural progesterone as a condition where a woman can have deficient, normal, or excessive estrogen, but has little or no progesterone to balance its effects in the body. So basically, it's not necessarily that you have more estrogen on board. It's just that it's not well balanced with progesterone. So you could have low estrogen levels and have estrogen dominant symptoms if you don't have any progesterone. So here are some root causes of high estrogen. A lot of these are major factors. You've got your genetics and stress. Stress seems to be a major factor in this day and age. When your gut is not healthy and you don't have a lot of fiber on board, you're not going to be able to detox well. So constipation is something we have to correct. Insulin resistance could also drive estrogen up. And if you are a poor methylator, we have to correct that as well, so that you can actually break down your estrogens and get rid of it properly. So here are some causes of estrogen dominance that I'm going to kind of highlight that are major. You've got diet, of course. Diet is huge. A diet high in sugar, alcohol, meat, dairy, processed foods, going to drive that estrogen up. If you are carrying a little bit too much weight, especially around the middle, you will also be driving that estrogen up, because fat cells make and store estrogen. So we want to try to lose some weight or maintain a healthy weight. Then we have exposures to exogenous estrogens, and exogenous just means not of the body. And so we've got synthetic estrogens that we're putting in, birth control pills, hormone replacement therapies that have synthetic estrogens in them. And there's also xenoestrogens that are endocrine disruptors coming from chemicals like parabens in skincare and food. You've also got plastics like BPAs, the bisphenols, the phthalates, the polychlorinated biphenyls, the PCBs, and then you've got insecticides like DDT and weed killer, herbicides, pesticides, and fungicides. We are living in a sea of estrogen. And also, if you've got a sluggish liver and it's just overwhelmed by toxins, it's going to be really hard for you to break them down and get rid of them, so they keep going back into circulation. And if you're a poor methylator, again, you cannot break those estrogens down properly, so they keep getting reabsorbed. If your gut flora is out of balance and your digestion slows down, it slows down the whole elimination process. And so estrogen just keeps getting reabsorbed into the bloodstream, and so their levels keep going up. So here's the path of estrogen. And as you can see here, in a healthy microbiome, everything pretty much moves and flows pretty well. Your liver isn't encumbered. Your gut is fairly healthy. So it's able to break a lot of those estrogen molecules and metabolites down so that you can get rid of them. So you want the majority of those estrogens to leave the body. But then in an unhealthy microbiome, if you'll notice here in the gut, what happens is, you'll make beta glucuronidase, which is an enzyme that actually creates estrogen reabsorption. And so some of the estrogen does leave the body, but most of it does go back into circulation. And that's where you get this accumulation of estrogen, creating estrogen dominance. So testosterone, these are the androgens, and it is the most common type of androgen. It is a group of male hormones that affect the reproductive health and sexual development in both sexes. It's made in the adrenal glands and the ovaries, and unfortunately, testosterone does decline with age. Some of the clinical benefits that we see with testosterone: absolutely, libido increases that sexual interest. It helps you to increase your muscle mass, tones your muscles, and gives you strength. It helps with your memory and decreases excess body fat, decreases bone deterioration, helps maintain bone strength, helps with energy. It increases emotional well-being, self-confidence, motivation, and it has an antidepressant effect. So because it elevates norepinephrine, which also helps with focus in the brain and focus and concentration, and it helps with pain control. Again, testosterone can also get out of balance, and some of the symptoms of deficiency are listed here. And you see, you get more tired, you may see some weight gain, definitely lower libido, sometimes muscle wasting, mild depression, and you'll also get like the droopy eyelids and the thin lips and the saggy cheeks. Causes of testosterone deficiency. So, of course, adrenal stress burnout. And again, in this very busy world, we are go, go, go. And we go all hours of the day and night. So our bodies cannot handle that. Birth control pills, chemotherapy, depression, menopause, whether natural or surgical. Statin drugs will also lower testosterone levels, and psychological drama. Some of the symptoms of excess: you can lose your hair, of course, road rage, anger, anxiety, depression. You can be tired, and of course you get an increased risk of breast cancer with too much testosterone on board. You'll get cravings, salt and sugar cravings. You may get hypoglycemia, which is low blood sugar, increased insulin resistance. You won't have as sharp of a focus in memory, and hirsutism, so hair growth. Some causes of high testosterone levels: so perimenopause and menopause will bring that on. Aggressive exercise, if you're just doing P90X and you're just going, and it's just you going hard 7 days a week. High DHEA levels can do that as well, because DHEA, which we'll discuss in later webinars, can actually convert to either estrogen or testosterone. So if you've got high levels, you can convert it over to testosterone, increasing that. Polycystic ovarian syndrome, and also if you're prescribed too high a dose of testosterone. So now we're going to go into the hormone phases of a woman's life. So here we start out with premenopause. So that's pretty much from preteen up to around the age of 35. And basically your cycles are pretty regular. Yes, there's probably times where it is erratic or it does change a little bit, but overall your cycles are regular. But then you start looking at from the age of 35 to potentially 55, there is this perimenopausal phase where you are transitioning over to menopause, and that's the beginning transitional phase. And that's when your cycles are very erratic. That's when your hormones start dropping. And that's when the healing, calming, happy hormone, progesterone, drops first. And estrogen is trying to cycle out. So you just never know when it's up or down. And then when you get to menopause, which is basically no cycle for 1 year, all your hormones are pretty much flat. You're pretty much done. And that's usually the happiest time of a woman's life hormonally. Premenopause. So in premenopause, we just discussed that you usually don't have any symptoms, but according to the Cleveland Clinic, hormonal changes can occur 8 to 10 years ahead of menopause. So I'm seeing a lot of younger women have hormonal disturbances and symptoms as young, really, as 28 now. And this is, of course, a time when you do still have your periods. They can be irregular, but not a lot of noticeable symptoms, or at least there's symptoms that are manageable at this point. So with perimenopause, this is when your body starts to transition into menopause. Yeah, and in this picture, it does look like she's becoming a monster here. So estrogen and progesterone levels fluctuate. It's very erratic. Your menstrual cycles become more irregular, and you may bleed more or less. Sometimes you may skip months. You also, as far as your cycles go, it could be longer or shorter. And at this point, when you're losing progesterone first, it does destabilize your adrenal axis, basically your stress response. And this is when women dive into that depression, anxiety, and insomnia. Menopause. So more than 1 million women enter menopause every day in the US. And that's basically the end of our menstrual cycle for 1 year. And the average age for menopause ranges from 35 to 45 years, but it's really 35 to 55. And menopause can be premature, or they can be a consequence of surgical or medical procedures. I love pictures. And I feel like pictures are worth literally more than 1,000 words sometimes. And it's really good for us to kind of see and relate to some of these symptoms so that we can help ourselves to manage them. So here are some peri and menopausal symptoms. I kind of group them together because a lot of these symptoms are interchangeable. And again, they're itemized here. Very similar symptoms to hormonal imbalances with excess or deficiencies in the sex hormones. So the major ones: hot flashes, night sweats, mood swings, depression, hair loss. These are the big ones that have given people such a hard time. And they're the most common: insomnia, indigestion, painful intercourse, frequent urination. And here again, some more symptoms: weight gain, big one, anxiety, decreased libido, vaginal dryness, itching, odor, weird dreams. It's another one too. So let's dive into hormone replacement therapy, and we're going to start with the synthetic hormone replacement. So synthetic just means that the chemical structure is not of our own body. It is one size fits all. So we are supposed to fall into the dosage forms and dosages that are available, that are conventionally available. It could also be animal derived, like Premarin or Prempro. And with Premarin, like the name implies, it is from pregnant mare's urine. And synthetic hormones do give incomplete messages to cells, so it fails to produce a balanced hormonal response. So in 2002, there was a large study. It's the Women's Health Initiative, and it was really a study on 2 drugs, Premarin and Prempro. And it was conducted with 16,000 women who had not had a hysterectomy. But unfortunately, the study did end 3 years earlier, just because researchers did find that these women on these particular hormones had an increased risk for breast cancer and heart disease. And it is estimated that 1/2 of women do quit taking their synthetic hormone replacement therapy after 1 year, just because they could not tolerate the negative side effects. For example, endocrine disruption. So they were having thyroid problems, mood disorders, mood swings, anxiety, depression. There were breast cancer, blood clots, heart disease, osteoporosis, liver tumors, hardening of the arteries, just to show you that the difference between the molecules. You've got a natural progesterone molecule here, and on the right-hand side, you'll see the medroxyprogesterone, which is synthetic. It is a progestin, and you see how different the hormones look. Synthetics are aliens to our body. Progestins, they are synthetic progesterone. They're alien molecules. They are not of the body. They interfere with the body's production of progesterone. They also stop the protective effects of estrogen on your heart. They can also increase breast cancer replication and growth because they do stimulate those estrogen receptors. And as a combination of estrogen and progestin, it does appear that they increase breast cancer mortality. And some of these are progestin side effects that we definitely don't need, since we're already getting them as a result of our transition to menopause. None of these are good. Depression, bloating, breast tenderness, low energy, low libido, hair loss, headaches, not being able to sleep, irritable, nausea, weight gain. Again, it lowers LDL, increases HDL. And here are some examples of the synthetic HRT. They come as pills, patches. They come as topical as well with the creams, gels, and sprays. And of course, also vaginal estrogen. So let's talk about natural hormone replacement. Oftentimes, when we think of natural, we think of hormones that are coming from a plant, like the soy or the yam plant, or from horses, which is a natural source. But actually, natural hormones, by the medical definition, it means that the chemical structure is bioidentical or identical to the ones that your body naturally makes. The beauty of natural hormone replacement is that it can be customized versus the one size fits all. There was a study in 2009 by Dr. Kent Holtorf, which was published in the Postgraduate, where he answered a lot of the questions about the safety and the efficacy of natural hormones over synthetic hormones. And after an extensive review of the medical literature, the article did conclude that the physiological data and the clinical outcomes demonstrate that bioidentical hormones are associated with lower risks, including the risk of breast cancer and cardiovascular disease, and that they are more efficacious than their synthetic and animal-derived counterparts. So until evidence is found to the contrary, bioidentical hormones remain the preferred method of HRT. So if you need references, that's a really good one to read. So here are some examples of conventional products that do have some bioidentical estrogens in them, but the only problem is that they add the unnatural or the synthetic progestins in it. So it's almost like you're bringing in something good and nullifying it with something bad. So with bioidentical hormones, a major advantage is that it can be compounded so that it can actually meet each person's individual need. And through hormone testing, we can figure out individualized dosing for each person. And hormones can be mixed into different dosages, special routes of administration. There are a lot of different bases that are available for topical hormones, and it just helps with absorption. Pharmacists and who are specially trained in hormone management do have a really good understanding and knowledge of hormone absorption and metabolism. So they're vital in any hormone management programs and working with your physician, to get you to goal. And some of the reasons to consider natural hormone replacement, of course, the relief of symptoms, preventing cognitive decline, bone production. So we want to prevent osteoporosis, heart health, growth and repair, Anti-aging skincare can be customized to fit each person. And of course, overall hormonal balance. These are some wonderful resources that you can go to for all of your hormonal questions. And also, they help guide you on your hormone journey as well. So, I would highly recommend these good readings. So, connect with us at Revelation Pharma. So thank you so much for listening today, and I hope that some of that information has been helpful for you. And look for some follow-up webinars on individual hormones and how they interact, and also hormone testing to come. Thank you, and have a super day.